Hey everybody, welcome back. This video is about barium sulfate, one of the most common contrast agents used in medical imaging. Barium is an ideal element for a contrast agent because it has an atomic number of 56. 56 is much, much higher than the atomic numbers for the main elements making up the human body. So why does the atomic number matter? With a high atomic number, barium attenuates much more radiation than tissue, and therefore the presence of barium creates more contrast in the images. By itself, barium would be very toxic to the body. So barium is attached to a sulfate molecule and it becomes barium sulfate. Barium sulfate is what we call a suspension, which means that the molecules are simply hanging in the contrast solution, but not actually dissolved into the fluid. Unlike iodinated contrast agents, barium sulfate is not water-soluble. For example, if left undisturbed, the barium sulfate molecules will settle to the bottom of the contrast container. Because barium sulfate is not water-soluble, it's used almost exclusively for evaluation of the GI tract, including the pharynx, esophagus, stomach, small intestine, and all aspects of the large intestine. When barium is administered in the GI tract, we call this enteral administration, whether oral or rectal. Enteral administration of barium sulfate is completely safe. It goes into the GI tract and comes right back out without having to be absorbed and without having to be transported by the body fluids. Administration outside of the GI tract is called parenteral administration, and this includes intrathecal injections for milligrams, intra-articular injections for arthrograms, and intravenous injections for IVPs and urograms. Barium sulfate is not safe for these kinds of imaging studies. Because barium sulfate is not water-soluble, it does not mix with water or blood or any other body fluids. Once it gets injected into these areas, the body has no way to get it out. And that's why there's one big contraindication for barium sulfate even in the GI tract, and that is perforated bowel. A perforated bowel means there's a hole in the GI tract that is allowing the GI contents to get out of the GI tract and into the rest of the abdominal cavity. If barium leaks out of the GI tract, that's a big problem. The body has no way to get the barium out, and surgery might even be necessary. If a perforated bowel is suspected, you absolutely must use a water-soluble iodinated contrast agent. Besides the issue of a perforated bowel, the side effects to barium sulfate are very uncommon and minor. Allergic reactions, like those we experience with iodine, are exceedingly rare because the body does not actually absorb any of the contrast material. Some GI issues are possible, such as stomach cramps, diarrhea, nausea, vomiting, constipation, but these issues are much more likely when the patient is dehydrated. Barium sulfate tends to absorb additional water in the bowel, and that can compound the issue of dehydration. All of these GI issues can be minimized by proper patient preparation, and that includes prehydration, which is increasing fluid intake before the exam, and post-hydration, which is increasing fluid intake after the exam. So that's an overview of the contrast agent barium sulfate.